So it has been about 2 months now since I last made the video about my chemo, my cancer diary, breast cancer. So I am done with the AC chemo now. The first part of the chemo, they say it's the worst part is over now. I'm going to continue now with Taxol. I'm going to start the Taxol treatment this Friday. Today is Monday, so on Friday. I'm going to have it every Friday for 12 weeks. So 3 months. The next 3 months it's going to be. Yeah, I can't say I'm looking forward for it, but you know, hopefully it's going to work and it's going to help. So I wanted to talk actually today about the side effects of the AC chemo, so what I endured this far. Well, first side effect, I lost all the hair. I lost the hair after the second chemo, AC chemo, about a few days after. It just started falling out like really heavily, and I just had to cut it. I cut it with scissors, actually, and then I used pear trimmer to shorten it as much as possible. And if you can see, there's still a little bit left that hasn't fallen off at all, like really thin hair is still there, and it's kind of staying. The doctor said it's probably not coming off at all. I'm also losing slowly my eyelashes. They're still there, but they're getting thinner, and my eyebrows are also getting thinner. Now the strange thing is that I still have to shave my legs, which is annoying. So I have had to shave my legs a couple times after I lost the hair, which is just stupid. I also lost the hair on the arms. It's not growing back, and the pubic hair actually. The pubic hair started falling off before this hair here, which I didn't kind of expect. I didn't think about it, but now other side effects. Nausea. I was very sick every single time I got the chemo. Actually, the first one wasn't that bad. The first one was kind of okay. Second was worse, and the third one I actually started vomiting. I vomited a lot. I vomited so much that the nausea medication, I vomited it out. I couldn't keep anything down, and I had to call my doctor, and she sent the prescription to the pharmacy, nausea medication that dissolves in the mouth, so that I wouldn't have to swallow it. And this way I was able to actually finally get the nausea medication to work again. And even though I was taking 6 different intravenously together and orally together, 6 different nausea medications, it still wasn't working enough. I was still really sick. It was horrible. Fatigue is another thing. You get really tired. It's just not just after the chemo, but the whole time. You're just tired. One thing I didn't know actually until I started getting it was that 24 hours after the chemo, AC chemo, I got a Neulasta shot. So I had to go back to the infusion center, and they gave me this shot. The idea is that this Neulasta shot increases your white blood cell count. However, it has quite annoying side effects. So basically for me, it was that I got the shot every time on Saturday, and by Monday I felt like I am having very severe flu. I was having, like, throat was shut and sore. I couldn't really even swallow. Then all my bones and muscles were aching. It's just like I just wanted to just stay in bed. It was really bad. I don't know, it depends. I have read that some people don't have any side effects whatsoever. For me, it was every single time I was really sick, like having really severe flu from Monday to Wednesday. So it was strange. And I wasn't actually able to go to work. I was rarely that sick, and I wasn't able to take care of my baby. I happened to have, well, at the moment, almost 9-month-old baby now, and it really hurts that, you know, you're a new mother and you cannot take care of a baby because you're so sick, and you're always so sick, and it's just, you miss out so much. So luckily my mom came over. She actually flew from across the Atlantic Ocean to America to stay with me and help me for three months with a baby. So I'm very grateful to her for that. Other side effects: constipation. Jeez, I don't want to go there. It's like, it's really bad. For me, it's really, really bad. One thing I'm doing with my teeth, my dentist told that because I'm going through the chemo, I should go and have once a month fluoride treatment. So actually I'm going tomorrow again to have one, because teeth are really sensitive, and I'm getting a really special prescription toothpaste to keep my teeth from falling apart. Yeah, so that's another thing to keep in mind, that while you're going through the chemo, to keep an eye on your teeth. Now I'm going to have Doxol treatment starting this Friday and next 12 weeks. They say that the nausea is not supposed to be that bad. I'm actually going to have only, I think, 3 different nausea medications this time, and I'm not going to have no Lasta shots at all. Yeah. Good news is that I had an ultrasound and mammogram last Monday after my 4th and last AC chemo, and it showed that I had responded quite nicely to the chemo this far. So I have 3 lumps in my left breast, and the smallest one was almost gone. They hardly could find it. It was at least 75% smaller. The biggest one was at least about 25% smaller, and this middle lump was about 50% smaller. And the big lump, centimeter size lump I had under the arm, had to also decreased severely. Like it's still there, you still find it, but it's much smaller, like, you know, less than half a centimeter. So this far chemo worked, and now I'm hoping that the Doxol is also going to work, so we'll see. Yeah.